Second white coat. Subscribe and like. Let's learn medicine together.
All right, today we're jumping right into a real medical detective story. We're talking about the brain, a hidden enemy, and an attack that comes from the inside. So here's the central mystery we're going to unravel. A man's mind is slowly slipping away, but the culprit isn't some outside invader. No, it's actually hiding in the very cells meant to protect him. So, how in the world is that even possible?
Okay, let's get into it. You know, to solve any mystery, you first have to understand the person at the heart of it all and really get a grip on the problem from the get-go.
So our story starts with a 43-year-old man. His family's really worried. They've been watching him for years as his thinking has gotten cloudier and his sharpness has just faded. And here's a really critical piece of the puzzle. He has advanced HIV.
Let's break down exactly what's going on. He's having trouble with memory, with planning things out, even with basic mental chores. But, and this is super important, look at what he doesn't have. No headaches, no weakness on just one side of his body. That tells doctors that this isn't a problem in one specific spot, like a stroke. It's something more spread out. And another big clue, he hasn't been great about taking his HIV medication.
All right, so we have the facts. Now comes the fun part, analyzing the clues. This is where doctors put on their detective hats. They start looking for patterns, trying to connect the dots between his story and his symptoms to figure out what's really happening.
So, if you were in the room, what would be jumping out at you? What are the biggest pieces of this puzzle that start pointing you in one particular direction? Let's walk through it together.
You see, it's all about the pattern, the signature this illness leaves. First, you've got advanced HIV and the patient isn't taking his meds, which means the virus is likely running rampant. Second, this decline is slow and steady, not something that happened overnight. Third, the type of thinking problem he's having, trouble with planning and organizing, points to the deeper structures of the brain. Doctors call this a subcortical pattern. And finally, because there's no specific weakness, we can probably rule out things like a stroke or a tumor.
And this specific pattern, it points a big, flashing arrow right at the HIV virus itself. But the way it attacks the brain is it's incredibly clever. It's sneaky. It's like a Trojan horse getting past the city gates.
And here is the absolute twist in this whole story. HIV doesn't actually infect the brain's nerve cells, the neurons, directly. Instead, it pulls off the ultimate inside job, tricking the body's own immune system into doing its dirty work.
So here's how this heist goes down. First, HIV basically hitches a ride into the brain, hiding inside immune cells called monocytes. Think of it as sneaking through the security checkpoint. Once it's in, the virus jumps over to the brain's own dedicated immune cells, the microglia and macrophages. From there, those infected cells turn into little toxic factories, just pumping out all these inflammatory chemicals and viral proteins. This creates a poisonous environment that over time damages and kills the neurons nearby.
A strong theory is great, but in medicine you need proof. You need the smoking gun. And to get that, we have to go from the big picture all the way down to the microscope, looking for the actual fingerprints this invasion leaves behind.
The first piece of hard evidence you'd find is something called microglial nodules. You can think of these as microscopic crime scenes. They're just little clusters of all those revved-up immune cells, all gathered in the exact spots where the neurons are being damaged.
And then you find the real telltale sign, the classic giveaway. Multinucleated giant cells. This is what happens when a bunch of those HIV-infected macrophages all merge together into one big, weird-looking cell. If you find these, it's pretty much case closed. It's a hallmark of HIV in the brain.
Okay, but any good detective has to check their work, right? You have to consider the other usual suspects. We've got to be sure that other things that cause dementia just don't fit the evidence we've collected.
And if we line them all up, it becomes crystal clear. Alzheimer's? That usually hits older folks and starts with memory loss, not this planning problem. Vascular dementia? That's more of a step-by-step decline, tied to little strokes. Huntington's? Well, that comes with very specific movement problems. You see, none of them really fit the unique pattern our patient has.
So after looking at everything, the patient's story, the specific pattern of his problems, that unique Trojan horse mechanism, and the smoking gun evidence under the microscope, all signs point to one and only one culprit. The official diagnosis is HIV-Associated Dementia.
So if you take one thing away from this whole explainer, let it be this formula right here. It's the whole case in a nutshell. When you see a patient with advanced HIV and that slow, subcortical kind of cognitive decline, your mind should immediately go to HIV-associated dementia, and you'll know that the proof, the microscopic evidence, will be those microglial nodules and multinucleated giant cells. A complete medical mystery solved.